One of the most common tests that I like to run with my patients in office is a test to see if they have low stomach acid, also known as hypochlorhydria. And I love this test because it's quick. When my patients do it through our clinic, it's free, which is always nice. So many tests that need to be run are quite expensive and cumbersome. So it's a quick and free test, which is lovely. And it's made such in identifying low stomach acid in patients and then addressing it has made such a huge difference for many of my patients over the course of time. Over the years, I've treated thousands of patients with chronic digestive disorders, and sometimes addressing low stomach acid is just pivotally important for them. In other cases, it's only modestly helpful. Some folks it's moderately helpful, and then in some patients, there's no change whatsoever when we address low stomach acid. And of course, not everybody has low stomach acid. So if it applies to a person, then to the extent to which it's going to help will vary, but it's something really worth looking at, in my opinion. The reason that the test is free for our patients here is because to do the test, it just requires taking a capsule of supplemental stomach acid known as betaine hydrochloride. And so we just have an open bottle up front and just give out those capsules for patients to do the test. So it's a cheap supplement. Happy to give out those free samples, no problem. So a really quick and easy test. Now, one question would be, well, is there a more formalized way of testing for low stomach acid outside of doing a stomach acid challenge test? And there is actually more formal testing for that. Unfortunately, the testing that's available, while it's very cool, it's like fascinating testing where you swallow a pill that has this sensor in it and it detects the pH in the stomach, and there's a little handheld scanning device, very Star Trek style, where you put it over top of the patient's stomach and test the pH, and you can actually test it as it's moving down through the intestinal tract to test the pH through the intestines, which is of some clinical relevance as well. So very cool, but just the cost of consumables for that type of test are quite expensive. We looked into bringing in the machine here, and just where patients would have to pay hundreds of dollars to get that scan done versus like the free stomach acid at home tests, like just really hard to I couldn't bring myself to invest in that machine, which is very expensive, and because it's just such an inexpensive alternative option to use this other methodology. So long and short of it is that for folks who are suffering with chronic digestive issues, if their stomach acid levels have, well, let me rephrase. As per usual, this is not medical advice. Everything I have said and I'm about to say is for informational purposes only. Please talk to your personal healthcare provider before making any healthcare decisions for yourself. But in terms of folks who are dealing with chronic health issues, if you haven't been assessed for low stomach acid and you're suffering from chronic digestive issues, please consider talking to your clinician about doing this test and seeing if it's something that might apply to your case. Over the years, I've had a number of patients who have come to see me. They've seen lots of other clinicians. They've done lots of cool tests and lots of cool therapies, very thorough, but they haven't had their stomach acid levels tested. And not every clinician knows about this test, but sometimes just a really simple basic test like a stomach acid test can be very useful and can make a really big difference for some patients. So I hope this information was helpful. If you have any questions about this topic or anything else, please post it in the comment section below, and I will answer as soon as I'm able to.